Hello parents, myself Dr. Anupriya. So this course is about teething in babies. We'll break it into what is teething, the timeline for teething, recognizing the symptoms of teething, the most common ones, the less common ones, the symptoms which are not caused by teething. How do you soothe your baby during teething, the foods which help you in soothing your baby, teething gels and medications, soothing techniques, how does sleep and food intake get affected during teething, how to maintain the oral hygiene, and the myths around teething. Now, what is teething? So, teething is a natural or physiological process by which your baby's teeth, that is, the milk or deciduous teeth, erupt or cut through the gum line. Teething can be a lengthy process, with teeth coming in gradually over months to years. Each tooth can take several days to weeks to erupt. Next, we'll discuss about the timeline for teething. So, age at which the tooth erupts can vary. Typically ranges between 4 to 14 months where your baby's first tooth erupts. It is a wide range of normal. Some babies are early teethers, whereas the others are late bloomers. Genetics play a significant role in it. So every baby has a different timeline, which is normal. Some may even deviate from the chart, which is completely okay. Focus more on the overall growth and development and not just the number of teeth. The common symptoms during teething. So first, increased drooling. Babies produce excessive saliva when they are teething. It can cause facial rash around the lips or over the chest due to drooling. Next, gum swelling and tenderness. The gums are often sore, red, swollen, causes itching, they are sensitive to touch. Babies chewing on objects. They take anything and everything inside and start chewing as it relieves the pressure, like toys, fingers, anything. Irritability and fuzziness. Teething can cause discomfort in babies due to which they are cranky throughout the night. Sleep disturbance. Teething disturbs babies' sleep patterns. There are frequent night awakenings. Decreased appetite. Sore gums makes it uncomfortable for the baby to eat or chew anything, due to which they can go on complete solid rejection, which is completely normal. So focus on hydration than solids during teething. They can also rub their cheek, nose, pull their ears. Drooling can irritate the skin around the mouth and cause facial rash. Teething can also cause slight raise in temperature, that is around 100.4, not beyond that. It doesn't cause high fever. Now the symptoms which are thought to be due to teething, but they are actually not. So firstly, high grade fever. So teething can cause slight raise in temperature, that is up to 100.4, but not beyond that. If baby is persistently having high grade fever, it's time to see a doctor. Next, diarrhea. So teething can cause excessive drooling in baby. There is severe itching, soreness in the gums. So the baby takes anything and everything inside their mouth, due to which the babies get infected, and hence there is diarrhea. So it is not normal, it is not a symptom of teething, it is infection. You need to see a doctor. Next, vomiting. If baby is having forceful vomiting, it is not normal, it is not attributed to teething. You need to see a doctor. So in short, if your baby is having high grade fever, diarrhea, vomiting, lethargy, dehydration, there's decreased urine output, you need to see your doctor immediately. Do not just think it is due to teething. Soothing techniques for teething. Firm rubber teether rings. So you can choose solid rubber teether rings which are BPA free and phthalate free. Avoid liquid filled teether rings which can leak. Next is cool washcloths. So you can wet a clean washcloth in cold water and give it to your baby to chew. The cold can help numb the gum. Teething gels and medication. So first of all, teething is a natural process. It's a physiological process. Your baby doesn't require medicines as such for teething to happen. You need to understand this. You can use the soothing techniques to relieve the discomfort your baby is having. But if your baby is extremely cranky, there are some times when the soothing techniques may not relieve the pain at all. So that's when you can use these few medications, but only if it's recommended by your doctor. So there are some over-the-counter teething gels, some which contain benzocaine or lidocaine, which are the numbing agents. FDA has issued a warning with the use of benzocaine gels causing a rare but serious condition called methemoglobinemia. So if you're using a gel, choose the one without benzocaine or lidocaine. Apply a very thin layer. The pain relievers, so paracetamol or ibuprofen. Use these if your baby is extremely cranky, very uncomfortable, and the soothing techniques are not helping at all. So you need to follow the dosage carefully based on your baby's age and weight. Use a measuring spoon or a syringe to accurately give the medicine. Ibuprofen is generally not recommended below 6 months of age. Next is foods and teething. You can give cold, soft foods if your baby is on solid. These chilled foods will provide a soothing sensation to the sore gums. Make sure that the size is appropriate for the baby's age and developmental stage to prevent choking. You can also give resistive foods like corn web or mango seeds to chew on. Avoid harsh foods which can break off easily and could be a choking hazard. And sugary foods that can cause tooth decay. Also avoid frozen foods. Examples of safe options: cold yogurt if your baby is not allergic to dairy, cold cucumber, chilled applesauce. Make sure all of these are under supervision. Always be near your baby and attentive. Oral hygiene during teething. So cleaning your baby's gums even before baby has a tooth is very important. So you can use a damp wet cloth or a silicone finger brush to gently wipe over your baby's gums. Gentle brushing of new teeth. Once the teeth emerges, you can use a soft bristled brush and water to gently brush your baby's teeth twice a day. So these early oral hygiene helps your baby to establish a routine and prevent tooth decay in future. Avoid putting your baby to bed with a bottle of milk or juice as it can lead to teeth decay. Make sure you brush your baby's teeth before going to bed. Now, dental visit. When should you visit your dentist? According to American Academy of Pediatric Dentistry, it recommends that a baby's first dental visit should be by the first birthday or 6 months from the first tooth eruption, whichever is earlier. Early visits allow the dentist to provide you guidance about baby's oral hygiene, check for proper tooth development, and identify any potential problems early. Early dental care is crucial for establishing lifelong oral health. Thank you.